Hello all, I'm Dr. Manmitha Reddy, pediatric ophthalmologist and adult consultant, currently working at Arvind Eye Hospital, Hyderabad. Today we'll be talking about digital eye strain or digital eye syndrome. It's also called computer vision syndrome. Now what is it? What are the symptoms? The symptoms of this are headache, redness, gritty sensation, blurriness for near vision. All of this come under this. So any symptom or sign which occurs secondary to prolonged exposure to screen time results in digital eye strain. Now why do I have all of these symptoms? Why do I have headache? Why do I have grittiness? I will explain it to you. So basically our muscles of the eye are made to view all the distances, that is far, intermediate and near, in a balance. But thanks to COVID, what have we done? We have just dedicated our eyes to just near work. So because of these, the muscles of the eye are always under contraction. So when we view a distance, the muscle relax. When we view something near, our muscles contract. So prolonged contraction finally causes spasm. Just like a neck catch. If you say I have a neck catch, my muscle has gone into spasm. Similarly, your eyes can also go into spasm. And that will reflect as eye strain, headache, watering, redness, gritty sensation, and of course refractive errors. Many studies have proven that prolonged contraction of the muscle can also result in elongation of the eyeball, which in turn results in myopia, that is minus power, refractive error or spectacle power. Now the second mechanism is dryness. So basically there is a tear film which protects the eye. When you watch a screen, when you concentrate and watch a screen, you tend to forget to blink. Because of that, the tear film does not get replenished because of the reduced blink rate. So obviously the tear film gets evaporated and this will cause dryness, grittiness, etc. etc. And when you have itching, you tend to rub your eye. And after rubbing your eye, that will again result in another power called cylinder power. That is again a refractive error or spectacle power. So now, before I go into precautions to avoid this digital eye strain, I need you guys to know about the AAP guidelines of screen time. The recommended screen time for children below 2 years is nil. You do not give them any screen time, even if they have to eat or even if they're having a tantrum or even if you have to babysit them. That's not an option. You only give them some occasional video call, that too with an important person like a traveling parent, and occasionally. Now second, 2 to 5 years, the non-educational screen time, recommended screen time is just 1 hour. Again, you all have to remember the minimum, the better. The farther the distance from the screen, the better, and the larger the screen, the better. And for children above 5 years, it's always an issue. It's always a battle. You need to strike a balance between your screen time and other activities like family time, meal time, homework time, play time. All of these need to be balanced. If any of these other times are being disrupted by your screen time, that means you're definitely exceeding it. Now that we know about all of these guidelines, I'll talk about the precautions. First thing, follow these guidelines, follow these screen time guidelines. Second, it's very important, 20-20-20 rule. This is applicable even for adults, both children and adults. When you're viewing computer, for every 20 minutes of screen time, screen usage, you have to take a break. That break doesn't mean you go from laptop to phone and look through your Insta and Facebook updates. No. You basically close your eye, or even better, you look at a distance, that is, which is 20 feet away. So this way you're relaxing your muscles and preventing your muscles to go into spasm. So for every 20 minutes, you need to take a break for 20 seconds and look at something which is 20 feet away. This is 20-20-20 rule. And the third, most important again, blink rate. Like I told you, your tear film gets replenished whenever you blink. So the normal blink rate is around 16 to 20. So if you're watching the screen and you forget to blink, again your eye, the tear film gets evaporated and your eye obviously will have dry eye symptoms. That is about it. Fourth, posture. Posture is very important. Please do not slouch and lie down on the bed and watch laptops, and even better, even worse, Some people lie down on their back and they put the screen on top of their heads. No, that's not advisable. You need to have a table and a chair, and your screen, even a small phone, big phone, laptop, whatever, it should be on the table and you should be sitting on the chair, and the minimum distance is at least 1 arm distance. And your system or your phone should be a little below your eye level, or at least at the eye level. Again, when you look down, your eyelids are covering your eyeball. That way the evaporation of your tear film reduces. So do not put your screen above your eye level, at least at the eye level or a little below the eye level. The next important point is illumination. You need to have a good ambient lighting, whether it is artificial lighting, natural lighting, it's okay. But you need to have a good lighting, and the brightness of the screen should be apt. How do you check the brightness of the screen? You take a white paper, put it beside your screen. The brightness of both of them should be equal. This is the correct lighting. And please do not watch your screens in dark. I know it's a theater feeling, it's a thrilling experience and all, but no watching screens in the dark with all your lights off. No, that's not recommended. The next thing I keep hearing is about these blue cut glasses. What are these blue cut glasses, blue filter glasses? These are magic glasses. If I wear these glasses, then I can see screen for how many hours I want to. No, these are not magic glasses. Blue light is just a part of white light, and we perceive it every minute. So many studies have proven that prolonged exposure to this blue light over time in a long run can cause age-related macular degeneration, that is retinal degeneration. But again, this will happen in adults, not children or young adults. So this is just a precaution that you need to follow. It's definitely not a replacement. And the next one, if you already have mild symptoms, you can definitely use lubricating drops. These lubricating drops are nothing but tear supplements. Like I told you, because of the evaporation of your tear film and reduced blink rate, your eye is dry. So you can replenish this tear film from outside by using these artificial tears. You can use it 4 to 6 times. They do not have any harmful effects. Again, it's always better to use preservative-free drops for children. And the next is outdoor activities. When I say outdoor activities, it doesn't mean you sit in the balcony with your phone in your hand getting exposed to sunlight. No, keep away all the screens. Just go into sunlight and just talk to a friend, dance, sing, do whatever, but keep your phones away. Many studies have proven that at least 2 hours of outdoor activity a day can reduce the progression of your minus power, that is myopia. Again, this is not reducing your power. This will just reduce the progression of your power. And the next, you need to have a digital free zone in your house. That means a place where you do not have accessibility to screens. Like when you're having a meal time, don't look into your phones. That is a digital free zone. Your dining table is a digital free zone. Don't take your phones or laptops or tabs or whatever. And please put your phones away 1 hour, at least 1 hour before your bedtime. This is like a cycle. If you keep using your phones, your sleep inducing hormone, that is melatonin, will reduce. If this hormone reduces, you don't feel sleepy. If you don't feel sleepy, you'll again go back to phone. No, break this cycle. Do not use any screen at least 1 hour before your bedtime. And you can also do digital fasting. Just like you avoid certain foods and do fasting once in a week or something, you can do digital fasting also. Just put all the screens away and just fast, digitally fast. And finally, you need to have regular ophthalmological checkups, at least one yearly, at least once in a year, because many conditions are diagnosed only incidentally. Especially in these COVID times, children come just with symptoms of dry eye. But then when you evaluate, they actually have power. Why they are not complaining of reduced vision? Because they are not going to school and they are not looking at the board. So they don't know that they are not able to see far with clarity. They are only seeing near work. They are only doing near work. So please come for yearly annual checkups. And most importantly, in these COVID times, mask up, sanitize and maintain social distancing.